The pieces of the puzzle is having adequate health services. The Westfield Memorial Hospital is absolutely critical for this small town to be a place where young families can move to and live and work.
My mother lives across the street, and I made it across the street, and she took me in her Jeep to the emergency room, and they gave me care, the Westfield emergency room. They gave me care immediately. I wouldn't have made it to Dunkirk. I wouldn't have made it to Jamestown. I wouldn't be here today.
No amount of hard work, creativity, talent, forward thinking is ever going to replace an emergency room. The closing of Westfield Memorial Hospital, or the emergency room at least, has a lot of parallels with the closing of the Welch's offices. But the big difference is that through a lot of hard work and forward thinking, we've been able to get over that, get past that, and rebuild the community. If the emergency room were to leave, there's no way that we could replace it. It's an irreplaceable and permanent thing.
Dear Governor Patterson, the Town Board of Westfield has found the operation of the Westfield Memorial Hospital to be a model for rural health care, stabilizing and providing life-saving emergency care for residents and travelers. We find this effort to close our emergency room unconscionable. This action will imperil the health and safety of our residents and that of thousands of additional residents from our neighboring communities and who rely on the Westfield Memorial Hospital emergency room. We urge you to consider the welfare of our mutual constituents for the reasons contained in the attached resolution of this board. Support of the Westfield Memorial Hospital. Whereas the New York State Department of Health has mandated that by June 30th, 2010, the Westfield Memorial Hospital must close its emergency room and convert to a 12-hour urgent care facility. And whereas an urgent care facility with limited hours would not be able to accept ambulances carrying patients in true emergency situations, and those patients would have to be transported instead to emergency rooms in Dunkirk, New York, Jamestown, New York, or Erie, Pennsylvania, all more than 30 minutes from Westfield in the best of weather. And whereas the mandate would impose a severe hardship on the elderly, our significant Amish population, and anyone else in need of immediate medical attention, by delaying the provision of such treatment, it inevitably will result in greater injury or loss of life that would have been avoided with the immediate attention available at a true emergency care facility in Westfield. And whereas the emergency room is a vital part of the town of Westfield's economy, providing employment to more than 50 people, and its closure would have a severe negative effect on the tax base of the town of Westfield in a time of economic downturn, therefore be it resolved that the town of Westfield believes that it is imperative for the health and welfare of its constituents and the surrounding area that Westfield Memorial Hospital continue to provide emergency room services, and that the quality of life in our community will be imperiled without the access to this critical facility. And be it further resolved that the town of Westfield strongly urges the Department of Health to re-examine the life safety impact of this decision and withdraw its mandate.
What I'd like to do is thank the community of Chautauqua County and the areas that we service and all of the members of the community who live here and work here in Chautauqua County. We have had outstanding support for our initiative to retain the emergency room here at Westfield Memorial Hospital. We've had community members who have dedicated countless hours to the pursuit of getting signatures and having letters signed. We are grateful for all of the support that we have received. We are thankful for the businesses who have allowed us to put petitions in their stores or in their office buildings to secure signatures. We are also grateful to our elected officials, the sheriff, the EMS council, the county executive, as well as Senator Kathy Young and Assemblyman Bill Parment. They have worked with us tirelessly to try to get this issue recognized by the state of New York and get an audience with both the governor's office and the Commissioner of Health. So I do want to say thank you to all of the folks who have helped us with this initiative. We couldn't have done it without the outstanding support of both our community and our elected officials. And hopefully we will be able to retain the ER here at Westfield for many years to come.